Hello again, everyone. My name is Marty Guthmiller, and I am the CEO at Orange City Area Health System, bringing to you a special briefing, community briefing today, relative to the COVID status. We're going to talk specifically about our nursing home today, Prairie Ridge Care Center, and we're going to talk about some unfortunate results that have occurred out there. What has transpired is we've had a positive staff member, we had a positive resident at Prairie Ridge. Because of that, we decided to test everyone in Pheasant Run and in Grandview Cottages, both on the west side of our facility. The good news is that Grandview rapid tests have all come back completely 100% negative. Those rapid tests are being followed up with the normal PCR or swab tests to confirm, but we're fairly confident at this point that Grandview has 100% negative. Pheasant Run, however, had 3 positive rapid tests yesterday. Just like Grandview, simultaneously we tested for the PCR test. We utilized the swab for that, and that is currently pending at this point. So it is not official yet that we've had the 3 positives, but it is likely that we've had the 3 positives. The definition of an outbreak by the Iowa Department of Public Health is 3 or more residents. And so if we confirm at least 2 of those 3 residents, we will have, by definition, an outbreak status put on us at Prairie Ridge. We are not waiting for that status at all. We are acting right now and yesterday, immediately after discovering this, that we're going to treat everyone like we are in outbreak status. Again, outbreak status sounds like it's all over. Technically, I guess you could say it is, but it's, again, the definition is 3 or more. And at this point, we would have 3 residents in Pheasant Run area. Staff testing is in process, and so we're conducting that as well. More importantly, some of the things that we have going right now out there for the protection of everyone, staff and other residents, is that we have implemented a negative pressure suite at Prairie Ridge that was planned for if needed. It was implemented yesterday afternoon, and we have a suite in Pheasant Run that is completely negative pressure, meaning that all air is being pushed outside. And we have 4 rooms within that suite currently in a negative pressure environment. We are also utilizing the ultraviolet light system, disinfectant system that we have, the robot, and we have utilized it extensively out there to decontaminate rooms, which does an excellent job at, and getting things ready for moving patients or residents around a little bit. So I'd like to give kudos to our maintenance staff for quickly implementing our plan, and giving kudos and thanks to our staff out there for handling everything in a very professional manner. Some of the implications that we have as preparing on how to act during this outbreak status is that we really need to lock things down pretty tightly. Residents will eat in their rooms, so there will not be any communal dining at all, except for those that need assistance in dining. We have eliminated all visitors at this point, including open window visitation. That is no longer permitted, no longer visitation outside either. So we'll try to accommodate as best we can, FaceTime kinds of conversations as best we can. Things like the hair salon have again been shut down, and so we are really doing everything that we possibly can think of right now to keep it contained to just these 3 residents at this point. So again, these results are preliminary. But so far, our validation process has remained pretty true with the PCRs, but we want to get out in front of this message a little bit, particularly because if these, when the PCR testing is confirmed, the Iowa Department of Public Health will publish this on their website. I think that's probably about it. The residents, obviously, because they're still at Prairie Ridge, the positives are not requiring hospitalization. That has been offered to them if their families are concerned, or if there merits that. These are not situations that require hospitalizations, but they do require isolation. And so we're being very, very careful with that. I also have another unfortunate incident to report, and that is that we have had our first COVID-19 related death in our health system, and that will be reported on the Sioux County stats either today or tomorrow. And all I can say about that, other than how unfortunate that is that was in the 80+ category. And so I wanted to make sure that I was transparent in that as well. That's the update that I have for today. I wish I didn't have to give this update, to be honest with you. But I want to end by saying that we continue with our antibody testings. We continue to have the ability to do rapid testing here in the health system. We will soon have the ability to do our own PCR testing. But for now, that PCR testing is going off to either the State Hygienic Lab or Sanford, and that is prioritized accordingly. And so we're here for you. We want to keep everything going as well as we can. We ask you to continue to socially distance, to continue to mask when it's appropriate, and you know that routine by now, and hand hygiene and those kinds of things. So I will be back tomorrow with more of a statistical report and a follow-up to either confirm or maybe not the results of these PCRs in terms of the rapid test right now positive that we've had. But again, we're relying and acting on these positives as if they have been validated, but we want to make sure that we do validate them prior to official notice. Any questions? Please feel free to let us know here at the health system. Again, we encourage you to stay strong, stay vigilant, and stay healthy. Thank you again.